COVID-19 cases beginning to rise again, comorbidities such as diabetes, heart, and chronic kidney disease are placing Texans at higher risk for hospitalizations to treat the coronavirus. Unfortunately, these same underlying conditions disproportionately affect Latinos who can find themselves in need of a life-saving organ transplant. Joining us today, Professor Rogelio Saenz shares how comorbidities are placing challenges in the battle against COVID-19 and the implications they can have on donation and transplantation. Professor Saenz, thank you for joining us.
It's a pleasure to be here. Thank you for the invitation, Clarissa.
Thank you. In August, an article in the San Antonio Express News stated residents in Bexar County and the counties in the Rio Grande Valley were found to have suffered more deaths per capita from COVID-19 than any other large urban area in Texas. Can you explain what comorbidities are and the role they may have in causing a higher risk of succumbing to COVID-19?
Yeah, well, one of the things that we find in the Latino community is high levels of morbidity, issues related to diabetes, for example, heart disease, obesity, and so forth. All these things that are commonly associated with poverty as well, and inequality. And as we know with COVID, that chances are that if you have these kinds of issues, like diabetes, for example, your risk of succumbing to the disease is much higher than it is for people who don't have those kind of ailments. Well, in July, that was that spike that we saw here in San Antonio, but particularly in the Valley. Texas is the only state where Latinos account for more than 50% of the deaths. The last analysis that I did was about a month ago that was suggesting that about 56% of the deaths here in Texas were to Latinos of COVID. So that really shows you, I think, the devastation.
When it comes to the impact of comorbidities on organ donation and transplantation, individuals living with these ailments should not rule themselves out as organ donors. Furthermore, people living with these underlying conditions can find themselves in need of an organ transplant. Latinos make up 43% of those on the national transplant waiting list. What other factors are contributing to Latinos being affected at a higher rate than their Caucasian counterparts?
I think that the other factor that we have here in Texas, you have a much higher portion of the population that is an immigrant. If you're here without proper documentation, that represents another fear of trying to go in to get tested, for example, or if you don't have transportation or whatever the case may be, or health insurance. In the Latino community in particular, there's among the population here in Texas that are 19 to 64 years of age, about 38% do not have healthcare insurance. And we know that that if Latinos as a whole lack healthcare insurance, people who are not US citizens, there's even a much higher percentage that don't have healthcare insurance. So these are issues related to the lack of access to healthcare. And we know that when people live in poverty, for example, that you have levels of segregation. And here in the West Side and other parts of the community where you see food deserts, for example, people that don't have access to good quality food, vegetables, and so forth. Latinos are a very youthful population. So in the Latino community, 1/3 are less than 18 years of age. Only 7% are 65 and older. And we continue to see, I think, in the demography of COVID deaths among whites, 90% of whites who have died from COVID are individuals 65 and older. In the Latino community, it's only about 65%. And that represents, I think, that we have a higher proportion of Latinos that are work age oriented. Many are in the front lines, have been in essential industries that have been put at greater risk of contracting the virus and so forth. And we also know that we have the higher levels of multi-generational homes, for example, where you have children, parents, and grandparents. And in some of those cases, I think where you have people that are working out on the front lines and so forth, that there is that added factor that the spread of the virus also can take place.
What solutions as a community can we work towards to reduce the impact of comorbidities?
Well, they're immediate and then the long term. So that many families, many people are losing their jobs during the pandemic and so forth. And for those that were lucky enough to have healthcare insurance through their employers, all of a sudden they don't have healthcare insurance. So a simple solution would be to increase to expand the Medicaid in order for people to be able to afford healthcare. And I think that here in this country, in particular, healthcare, we have the most expensive healthcare system, and it probably comes in maybe 15th, 20th compared to other advanced countries in terms of effectiveness and trying to prevent and improving diets, improving access to good quality foods, regular kinds of checkups, as opposed to the way the healthcare system is here in the United States. It's after people have developed these major issues, diabetes, hypertension, and so forth, that then all of a sudden, then we're trying to cure it where it could have been prevented at an earlier period in time with regular preventive health care.
I appreciate your time and the information. And remember, you too can share your why and sign up to save lives as an organ donor. You can visit our website at tosa1.org and tune in to the next TOSA Talks.